right, thank you very much, Mike. And would you stay on the line so that the media can ask you some questions after our other presenters?
Absolutely.
And next on the call, we have our Resource Management Agency Director, Carl Holm. He's going to give us an update on what's happening with county parks and the lakes for this holiday weekend.
Hi, thanks, Mayor. Yes, so we are continuing the operations as we have been for the past couple of weeks, where the parks are open for trail use. There's still no gatherings, no picnic areas will be open, no playground areas are open. With the lakes, the lakes are open, but with restrictions. There's no overnight camping, it's all day use. And there's a limit on the number of boats at Lake Nacimiento. It's a limit of 120 boats per day. And at Lake San Antonio, it's a limit of 50 boats per day. Fishing is allowed. You can come in and fish along the shoreline, or if you have your own private boat, as well as, again, using the trails. So it's really status quo of where we have been, and we're gonna continue in that operation for a little while.
All right, thanks very much, Carl. And then if you would also stay on the line for any questions in a little bit.
Sure.
And then we have Lupe Rodriguez. She's with Planned Parenthood Marmonte, and she's going to give us an update on the MPC clinic. Hi, Lupe.
Hi, thanks for having me. So as many of you know, the Monterey Peninsula College clinic that we opened with, again, collaboration with the college at Planned Parenthood Marmonte, has been operating since Monday. Unfortunately, we, because of the great response from community members and their need for testing, we exhausted our supplies for the week a bit earlier than we expected. We are in the process of procuring new supplies from our lab colleagues and expect to be back open on Tuesday of next week. We will provide details specific over the week, more specifically over the weekend about that. But that's the projection and expectation at this point. And we are hopeful that we'll be able to increase our capacity. We have seen, as mentioned, that there has been a great response from the community, a great need. And so we're also evaluating how we might be able to expand on our 100 tests a day maximum capacity.
All right, thank you very much. And then we also have Charles Mckee, our CAO, on the call today, who's going to share his thoughts with us.
Thank you, May. I appreciate the opportunity. I apologize for coming in late. It wasn't that I preferred to have a crown replaced at the dentist than being on the media call, but it was a close second. So I appreciate the opportunity, but I just had to return from an emergency procedure at the dentist. I think, as everybody knows, that there's a change from the state criteria on moving to phase 2 of stage 2, or phase B of stage 2, as people are calling it, with the reopening of the state. Excuse me. That could potentially allow the county of Monterey to move more quickly than just following the state. The previous criteria, under the previous criteria, the county would not have met the metrics that were outlined to have a faster reopening than the state would allow. Under the new criteria that was announced on Monday, we are pretty confident that we're going to be able to meet the criteria that is set forth by the governor to move more quickly through phase 2. I think one of the important messages here is that we have to make sure that we locally are doing it with deliberation and consideration of balancing the needs of public health, which can include the spread of coronavirus, but also can include the impact that the loss of businesses, the stress on businesses, and the stress on those people who are unemployed. That balancing act is very difficult, and we want to make sure that we're not, making some false choices, and that we're making the right choices to be able to open and keep our county open. I think, as many people heard me the other day say, that if we have some backsliding, That would not be very good for our community, our economy, our psyche here, and we don't want to open ourselves up to a surge in the spread such that we have to reimpose restrictions, because I think that would be very hard to do once we ease restrictions, to reimpose restrictions. However, with that said, a key component of being allowed to move more quickly, excuse me, through phase 2 is to have a containment plan and to have some metrics to guide us through what we're going to do as a county if we see, after a easing of restrictions, an increase in cases or an increase in hospitalizations. What are the methods we're going to use to get a handle, or kind of a rehandle, on the spread within Monterey County? And that's something that the health department is working on right now. And that's why I don't, that we're not having them participate in some of the different meetings that are going on, because they have to focus on getting the work done to be able to have the reopening. But one of the key pieces, as I said, is what are we going to do if we have a surge? And we want to get the message out to the community that we've done such a great job to this point. The compliance has been remarkable. If you look at other counties, we are far ahead of most other similarly sized counties or similarly situated counties. There are a few that are similar to us as far as rates and spread, but most of all, we are way ahead of most other counties, and we want to keep it that way. So the message should be that as we reopen, keeping those good health practices in place will allow us to continue the easing and move back to some semblance of normalcy. So with that said, I will turn it back to, before I end that. So one of the other pieces that everybody should know is that we're working with, we've got some great compliance with the hospitals. They've already provided the data that we need. And so it's great to see that the hospitals have the surge capacity that is being requested by the state. And in addition, part of it is also reaching out to our community about how's the community feel about the reopening. And so what we're doing is we're reaching out to all the cities, because as we reopen, we know as a county that most of the businesses that we're talking about are in the cities. And so we need to know, how do the cities feel about this? What's their position? How are they going to handle it? Do they have the capacity to handle this? Do they have the enforcement pieces in place to handle it? And what are their residents thinking? The county has most of the agriculture, but the cities have most of the other individual businesses, and we want to know their opinion on it, where they stand. And so I'm trying to participate in many of the city council meetings to try and help get some questions answered, and also hear from them as far as what their position is on moving through phase 2 more quickly and getting a variance from the state. So with that, I will turn it back to Maya.
All right, thanks, Charles. Pretty good for Novocaine. So we're going to start with some questions. And again, we don't have anyone from our health department on the call. So if the questions that I have that are data specific to coronavirus, I can't have anyone answer those questions today. I can try to forward them for a later response. But I do have a question for Mayor Lebar. With Monterey and Carmel closing streets to assist businesses, is King City considering a similar public space shift in use for restaurants or markets to use for seating or sidewalk sale space?
We have not had any of those requests as of yet. Our position is a lot like how Charles had laid out, is we want to do this in a methodical way. We want to get all of our businesses to follow the state rules on their guidelines and the checklist, because that is an important component. We would look at all options. We would work with our police department, our city staff, our public works. And if it is a safe alternative, I don't see any issues with that, but we just haven't had any requests.
Right, thank you. And then Charles, I don't know if this is something that you can speak to, whether you know whether the attestation plan to work with skilled nursing facilities, if there's a task force or other group working on skilled nursing facilities.
I don't know whether I call it a task force, but there is a team within the health department that is working with the skilled nursing facilities to make sure that they have the plans in place that they need, that the health officer has to which the health officer has to attest, as well as the PPE and the sanitizer and the supplies that they need. So the health department does have a team that is working closely with all the skilled nursing facilities and also reaching out to the assisted living facilities.
Thank you. And then for Mayor Lebar, in light of the cancellation of the Salinas Valley Fair, how much revenue has the city lost? What budget-wise is the city looking into?
We're expecting significant losses. We started planning for contingencies a few weeks ago. A lot of losses for cities is going to come in a couple quarters from now when we start receiving the sales tax revenues that were generated during this period. So we're planning for that. Our focus is to keep all of our staff. We have a great group of people who've been doing some amazing work for our city. We don't want to lose them. But we're looking at every way that we can either cut our cost, push back projects, and try to do as much with our already grants that we have in place. But we'll weather through this. And I firmly believe the economy is going to pick up very, very quickly. It was strong before all of this. And we have a great group of business owners. We just have a great community. And so once we get moving and we do this in a good, safe way and know what we're doing, it's going to make us stronger in the long run.
Thank you very much. And then that's all the questions I have through chat. Is there any questions by phone from any of our media partners? Hearing none, that makes this possibly the shortest media briefings we have had since the end of March. And I appreciate that for a Friday. Thanks very much. Thanks for all our participants and thanks for joining us. There will be no media briefing on Monday, Memorial Day. Have a nice weekend.
Thank you.
Thanks, everyone.